Hello, everyone. My name is Diego Gomez, and I'm a first-year medical student at the Mayo Clinic Alix School of Medicine in Phoenix, Arizona. Today, I'm excited to present a review of our efforts to develop, implement, and evaluate an LGBTQI plus curriculum at our medical school. This project would not be possible without the enormous help of my classmates, Madeline Whitney and Jay Vasilev, as well as our faculty member, Dr. Kling. As a little bit of background, we know that the LGBTQI plus community faces many barriers to healthcare access due to general prejudice and discrimination, and are more likely to suffer from chronic health conditions, experience higher rates of mortality from these conditions, and have an earlier onset of disabilities compared to their straight, cisgender peers. LGBTQI plus related content is consistently lacking in health science educational programs. For example, a survey of US and Canadian medical schools found that the median time dedicated to LGBTQI plus topics is only 5 hours. In order to address the gap in LGBTQI plus healthcare education, we have developed a week-long 20-hour selective that will be delivered at our medical school this April. First-year medical students in Minnesota and Arizona are eligible to sign up for the selective. The selective will be facilitated by medical experts in internal medicine, endocrinology, and psychiatry who care for and interact with members of the LGBTQI plus community in their daily practices. The curriculum is divided into 3 days. The first day will address mental health in the LGBTQI plus community, focusing on concepts like sex and gender identity, as well as the minority stress that this community often experiences. Other topics that we will cover include disparities in gender-affirming interactions, cultural humility, and gender-affirming behavioral health assessments. We will also cover the different types of letters of support that transgender and gender-diverse individuals may need throughout their medical care. The second day will focus on primary care for LGBTQ individuals and transgender and gender-diverse individuals. A particular focus will be placed on gynecologic care for transmasculine patients and body contouring as gender affirmation. Additionally, we will discuss differences of sex development and their management in the pediatric population. In relation to youth and adolescents, we will cover gender dysphoria, gender-affirming psychotherapy with adolescents and their families, and hormone therapy in transgender adolescents. Our last day will focus on masculinizing and feminizing hormone therapy, fertility preservation among transgender and gender-diverse individuals, and gender-affirming surgical procedures. In order to quantify the effectiveness of our curriculum, we have developed a survey that will be administered to the selective participants both before and after the educational experience. The survey addresses 3 key objectives. First, student attitudes towards LGBTQI plus patients. Second, comfort treating LGBTQI plus patients. And lastly, knowledge of health factors related to these patients, as well as a final demographic assessment. For example, students will be asked to rate questions such as LGBTQI plus patients should disclose their gender identity to their physicians on a Likert scale. They will also be presented with factual information from the selective curriculum and asked to rate it as true or false. In summary, we hope that by introducing an LGBTQI plus healthcare curriculum in our medical school, students will increase their knowledge and comfort level in treating this population. In addition, we hope that the results of the survey will inform changes to the curriculum and lead to an expansion of this educational experience for all medical students across all campuses. Once again, thank you so much for the opportunity to present our work here.